Hi everybody, my name is Rebecca Vera. I'm going to be talking about lower gastrointestinal bleeding. Today my grandmother is actually in the hospital for a lower GI bleed of unknown source, so they're currently going through the diagnostic process of finding out what is causing it. A lower GI bleed occurs in the jejunum or ileum of the small intestine, colon, or rectum. So here is the anatomy, starting at the jejunum, working our way down in the colon and down into the rectum. Some factors that can contribute to lower gastrointestinal bleeding are polyps, diverticular disease, inflammatory bowel disease, cancers, hemorrhoids, and colitis. The pathophysiology, the diverticular disease accounts for up to 40% of lower GI bleeds. Chronic constipation and altered motility leads to inflammation and irritation, which will lead to the bleeding that will come out in the stools. And the most common cause of lower GI bleeds in patients younger than 50 years is anorectal disorders or hemorrhoids. Hemorrhoids occur when supporting tissue of the anal cushions disintegrate, which causes venous dilation, bleeding, which occurs when the veins are irritated by straining, passing of large firm stools, and constipation. Some of the clinical manifestations would be blood in the stools, bleeding from the anus, decrease in blood pressure, increase in heart rate, lightheadedness, loss of vision, and decreased urine output for loss of large amounts of blood. More than 80% of lower GI bleeds will stop spontaneously. Diverticular disease may need to be treated with injections of adrenaline, and hemorrhoids can be treated with topical creams or removal of the hemorrhoids. Some of the diagnostic testing can be CT scans for non-invasive testing or colonoscopy within the first 24 hours to determine the cause and proceed with treatment. So currently we are in the stage with my grandmother of getting the prep for the colonoscopy, so hopefully we can determine what is the cause of her lower GI bleed. I hope you enjoyed this discussion and I hope you'll have a great day.